Welcome, everyone. Today, we're going to explore an exciting topic. What does a pulmonologist do? From Paris Hospital News, we're here to shed light on this important medical specialty. Over the next few minutes, I'll tell you about the role of pulmonologists, what they do to help patients, and why they are essential in healthcare. So, let's get started and discover more about this fascinating field. Welcome to this part of our presentation. As per the latest news from Paris Hospital, if you're experiencing issues related to inflammatory, structural, infectious, autoimmune, or neoplastic disorders, it's crucial to connect with expert and certified pulmonologists right away. But before you reach out to these specialists, I recommend checking out this post to gather some useful insights. Many health conditions, like bronchitis and asthma, directly impact our respiratory system. That's where pulmonologists come into the picture. These are the medical professionals who specialize in diagnosing and treating various respiratory issues. Whether you're dealing with asthma, which can affect your daily life, or struggling with more serious conditions like tuberculosis, you can rely on pulmonologists to guide you. Their expertise is vital in managing and improving respiratory health, which ties into our overall theme of understanding and addressing complex health challenges effectively. In addition to the general field of pulmonology, there are also several subspecialties that focus on specific areas and disorders related to breathing. For example, sleep and sleep-related breathing disorders are a key part of these subspecialties. So, if you're dealing with a particular health issue in this area, you'll typically be treated under one of these specialized fields. The good news is that Paris Hospital offers all of these services, which means that cases of negligence are essentially ruled out because comprehensive care is available under one roof. One important condition we often encounter is neuromuscular disorders, which refer to situations where your respiratory muscles may fail or start malfunctioning. This can significantly impact your ability to breathe properly. Another common area involves obstructive lung disease, where airway obstruction or narrowing occurs due to various health conditions. This can cause breathing difficulties and requires specific management strategies. When it comes to more complex procedures like lung transplantation, pulmonologists are involved not only in the surgery itself, but also in managing preoperative and postoperative care. This comprehensive involvement is crucial for successful outcomes. Interstitial lung disease is another group of conditions that affect the tissues and spaces within the lungs. These can be quite challenging to diagnose and treat, but with specialized care, patients can receive the appropriate interventions. Interventional pulmonology is a particularly interesting subfield that involves minimally invasive procedures to diagnose and treat lung diseases. It's a multidisciplinary approach that plays a vital role in modern pulmonology. At its core, pulmonology is focused on the respiratory system, which includes the lungs, airways, such as the mouth, nose, voice box, throat, windpipe, alveoli, bronchi, and bronchioles, and the respiratory muscles like the intercostals and accessory muscles. All these parts work together to facilitate breathing. Our subspecialties in pulmonology are designed to address specific issues within this system. And as I mentioned earlier, Paris Hospital provides a comprehensive range of these services, ensuring that patients receive the best possible care. When it comes to conditions that pulmonologists typically treat, there's a wide range of respiratory issues to be aware of. For example, infectious diseases like tuberculosis are a major concern, and they require specialized care. Then there are occupational lung diseases, which happen due to inhaling harmful chemicals, proteins, or dusts at work. These can significantly impact lung health over time. We also see breathing difficulties like obstructive sleep apnea, which disrupts sleep and reduces oxygen intake during the night. Chronic conditions such as COPD or chronic obstructive pulmonary disease, including emphysema, are common and often progressive. Interstitial lung diseases involve persistent scarring and inflammation that can impair lung function. Bronchiectasis is another condition where excess mucus builds up along with inflammation, leading to recurrent infections. Asthma, of course, is a well-known condition characterized by airway constriction and breathing difficulties, often triggered by allergens or irritants. Additionally, chronic and acute bronchitis involve inflammation of the lower airways, causing cough and breathing issues. As highlighted in the Paras Hospital news, our expert pulmonologists are equipped to treat all these conditions effectively. Understanding these key issues helps us appreciate the broad scope of pulmonology and the importance of specialized care for respiratory health. On this slide, I'll walk you through the key tests and procedures that our pulmonologists at Paras Hospital use to diagnose and treat lung conditions. First, we have bronchoscopy, which allows our specialists to examine the airways directly. This helps us identify any issues with the voice box, throat, lower airways, or windpipe. It's a crucial step in pinpointing the source of breathing problems. Next, there's the sleep study. This test helps us detect sleep-related disorders like insomnia and sleep apnea, which can significantly impact lung health and overall well-being. We also perform pulse oximetry, a simple but vital test that measures how well oxygen is being delivered into your blood. It's essential for understanding if your lungs are functioning properly to oxygenate your body. Then we have the pleural biopsy. This involves removing small tissue samples from the pleura, which is the lining around the lungs, for further analysis. It helps us diagnose conditions like infections, inflammation, or cancer. Another important test is the pulmonary function test. Think of it as a breathing test that measures how easily your lungs can expand and contract. It gives us a clear picture of lung capacity and airflow. Ultrasound is also used to examine the organs and structures within the chest. It helps us visualize the heart, blood vessels, and other tissues in real time, aiding in accurate diagnosis. Finally, we start with a CT scan. This advanced imaging technique provides a detailed view of the muscles, bones, organs, blood vessels, and fat inside your chest. It helps us get a comprehensive understanding of your condition. All these procedures are part of a thorough process that our certified medical professionals at Paras Hospital follow to effectively treat lung diseases. They work together to ensure we understand your condition fully and provide the best possible care. When a lung condition becomes particularly serious, our pulmonologists at Paras Hospital may decide that a patient needs to see a specialized chest surgeon. This ensures that the patient gets the most appropriate and effective treatment. One common procedure we perform is thoracentesis, which involves removing excess air or fluid from around the lungs, specifically from the pleural space. This helps relieve pressure and makes breathing easier for the patient. Another important procedure is the placement of bronchial or tracheal stents. These are tiny devices that are inserted to open up blocked airways like the bronchi or windpipe, restoring proper airflow. It's essential to understand that these procedures are part of the comprehensive care our expert pulmonologists follow. They are designed to address complex lung issues effectively, always aiming to improve patient outcomes. So, even when dealing with the most challenging cases, our team at Paras Hospital follows these key procedures to ensure the best possible care. It's important to remember that there are many other health conditions where consulting a pulmonologist is essential. If you're experiencing any of these issues, Paras Hospital is a trusted place to seek expert advice. Trouble doing everyday activities because of breathing problems is a clear sign that you should get checked. If you notice you're smoking more or having difficulty quitting, that's another red flag. Unexpected weight loss can sometimes be linked to underlying respiratory issues. Coughing with mucus or blood, or having a persistent cough that just won't go away, these are serious signs that need medical attention. Difficulty breathing and wheezing are also symptoms that should never be ignored. If you're facing any of these worrisome or unusual respiratory issues, it's crucial to consult a pulmonologist. In fact, some of the serious cases we've seen at Paras Hospital involved these very concerns, and early consultation made all the difference. So, why see an expert pulmonologist? because they can help diagnose the problem accurately and guide you towards the right treatment. Remember, addressing these symptoms early can prevent more serious health issues down the line. Your lungs are vital to your overall health, and expert care can make a real difference. When it comes to respiratory health, whether you're dealing with temporary issues like a mild pneumonia or a common cold, or facing more serious respiratory conditions, it's crucial to seek expert advice. And for that, Paras Hospital is a trusted choice. They have a team of experienced pulmonologists, including well-known specialists like Dr. Shivam Dixit, Dr. Mayank Kapoor, and Dr. Aranesh Kumar, among others. If you're unsure or need detailed consultation, I recommend booking an appointment or visiting the hospital directly. Remember, timely consultation can make a significant difference in managing your respiratory health effectively.